What caused infections during the Civil War? Have you ever wondered why so many soldiers fell ill during the American Civil War? The answer lies in a mix of unsanitary conditions, limited medical knowledge, and poor healthcare practices. Soldiers lived in crowded camps where sanitation was almost non-existent. They faced contaminated food and water, leading to intestinal diseases like typhoid fever and amoebic dysentery. In addition to these diseases, parasites such as lice, fleas, ticks, and mites thrived in the heavy wool clothing and filthy environments. These pests transmitted diseases including typhus and relapsing fevers. The conditions were dire, and the lack of cleanliness made it easy for infections to spread rapidly among the troops. Medical care during the Civil War also played a significant role in the spread of infections. Surgeons often moved from one patient to another without washing their hands or sterilizing their instruments. They reused sponges that were rinsed only in water, which meant bacteria could easily transfer from one patient to the next. Hospitals were overcrowded and poorly supplied, making it difficult to provide adequate care. Battlefield surgeons were often rushed and undertrained, performing quick amputations without any sterile techniques. At that time, the germ theory of disease was not yet understood. This meant that infection prevention measures were minimal. Even minor wounds could lead to deadly infections, as soldiers had little protection against bacteria. Poor hygiene, a lack of nutritious food, and the stress of combat weakened soldiers' immune systems. This made them more susceptible to infections. The proximity of latrines to living and water areas further contaminated their environment. These combined factors made infections the leading cause of death among wounded soldiers during the Civil War. The lessons learned from these experiences led to significant medical innovations in the years that followed. Improved sanitation practices, the development of vaccines, such as for typhoid fever, and the adoption of antiseptic techniques in surgery greatly reduced infection rates in later conflicts. However, during the Civil War itself, the lack of understanding about germs and the poor conditions made infections a common and tragic outcome for many soldiers.